Good afternoon, everybody. Let's just wait for 5 minutes for participants to join in, and then maybe we can begin. Should we start now? Let's go ahead. Good afternoon, everyone. Welcome to the Global Evaluation Week 2024. I'm Prakriti, and I'll be moderating the session today. I work as a Senior Research Associate at IWAGE. So IWAGE stands for Institute for What Works to Advance Gender Equality, and we aim to build on existing research and generate new evidence and facilitate the agenda of women's economic empowerment. Apart from conducting rigorous research and analysis, IWAGE also engages and collaborates with policymakers and advocates who are actively involved in accelerating women's involvement in the Indian economy. We also test interventions with the aim to make them gender transformative. We are joined today by an esteemed panel from IWAGE highlighting childcare and women's work. Are these connected? The panelists, with their expertise and experience, will discuss the intricate connection between childcare responsibilities and women's labor force participation, and share their work on advancing efforts to support women's economic empowerment through improved childcare solutions. Today, we have Dr. Bidisha Mondal. She's a research fellow at IWAGE. She recently worked on a study to capture women's time and activities better, and has previously worked extensively on understanding various dimensions of socio-economic inequalities. Her core research interests lie in analyzing gender gap and discrimination faced by marginalized social categories in the Indian labor market. Vidisha has completed her master's from University of Calcutta and her PhD from Center for Economic Studies and Planning, Jawaharlal Nehru University, New Delhi. Welcome, Vidisha. I would also like to welcome Divya Singh. She works as a research manager at IWAGE. She has previously extensively worked on issues of early childcare, gender equity, and environmental sustainability. She has around 10 years of experience in the field, working for national, international development organizations. She has an MA and MPhil in political science from Jawaharlal Nehru University and an MSc in environmental assessment and management from the University of East Anglia. Welcome, Divya. And finally, as our third panelist, we have Shruti Kutty. She is a program manager of research at IWAGE. In the past, she has done various roles in the policy and government consulting realms, working on a range of developmental issues with think tanks, government agencies, civil society organizations, and citizen groups. Before joining IWAGE, she worked with UN Women as the coordinator of the Feminist Policy Collective. Shruti's experiences comprises of diverse engagements around feminist economics, women's entrepreneurship, gender-sensitive urban planning, as well as documenting the gendered impact of development projects. She holds a bachelor's degree in engineering from Mumbai University, a master's degree in public policy and governance from Azim Premji University, and a PG diploma in communications from Xavier's Institute of Communications, Mumbai. A very warm welcome to you, Shruti. A few housekeeping things to keep in mind before we begin. I would kindly request the participants to mute their microphones when a panelist is speaking. Each panelist will present for about 15 to 20 minutes. I would also request the attendees to ask their questions using the Q&A tab during the presentation. The panelists will take up a few questions post the discussion, and we shall try to answer the remaining ones in the chat box itself. We will also be recording this session, so if there is any concern regarding the same, you can tell us now. And as we delve into today's topic, which is childcare and women's economic participation, it's crucial to consider the broader implications of our discussion. The International Labour Organization estimates that unpaid care work is amongst the most critical barriers preventing women from joining and remaining in the workforce. Unpaid childcare responsibilities significantly hinder women's labor force participation. Therefore, it's crucial to enable women's economic empowerment while ensuring that their children are well cared for. I would like to ask Vidisha if she could tell us how care responsibilities could affect Indian women's labor force participation rates.
Thanks, Prakriti, and good afternoon, everyone. Uh, should we start the presentation?
Yes, Vidisha, go ahead.
The next slide. We can go to the background, but yeah. So today I'll be sharing some national level evidences on how childcare responsibilities are actually influencing women's labor force participation decision. And not only that, how the childcare responsibilities are actually influencing women's choice of work. Now, these evidences will be based on the latest round of PLFS, which was conducted during 2022-23. I'll take you through the background very briefly. According to the PLFS rounds, the female labor force participation rate has increased from 23% in 2017-18 to 37% in 2022-23. However, this is still much lower than the male labor force participation rate in India, which stands at 79% according to the same PLFS round. Also, this FLFPR is not uniform across the different demographic and socio-economic cohort. As for example, the FLFPR for those in the age cohort of 15 to 29 years is very low at 24.5%. However, this might be to some extent due to females in this age cohort pursuing education. Also, the quality of employment actually varies among the different cohorts of female workers, and a very significant percentage, around 37% of female workers, are actually engaged as family workers, unpaid workers in family businesses. Now, this sort of engagement is thought to be of poor quality of engagement, and because of its non-remunerative nature, actually it doesn't lead to women's economic empowerment, unlike other mainstream labor market engagements. Now, to have a global comparison, we looked at the ILO modeled estimates. These modeled estimates are available across almost 189 countries and at various regional and sub-regional level. According to the ILO modeled estimates, the FLFPR in India is actually marginally lower even after the increase. It's actually marginally lower than the South Asian average and significantly lower than the global average, which stands at 47% in 2022. This low FLPR and poor quality of engagement among women workers happened despite the country witnessing a very long period of high economic growth in the last 2 decades. Now, high economic growth is supposed to lead to higher economic opportunities and in that way leading to an increase in FLPR, but that hasn't happened in India's case. Also, according to the NFHS data, the fertility rate has declined from 4.04% in 1990 to 2% in 2019-21. And the decline in fertility rate by reducing the childcare responsibilities was supposed to lead to an increase in FLFPR. But that also didn't happen in India's case. Also, the increasing educational attainment of Indian women, that didn't lead to a proportionate increase in FLFPR as well. So there are numerous studies which tried to explore the factors working behind the low FLPR, and a few studies pointed towards the supply side factors like mobility constraints, safety concerns, restrictive gender norms, and few pointed towards the demand side barriers like lack of employment opportunities, negative employers bias, impacting female labor force participation negatively. Few studies pointed towards the disproportionate share of unpaid care responsibilities, which burdened by women, as a factor behind their low labor force participation and lack of women's economic empowerment. Now, as I mentioned previously, that the decline in fertility rate by reducing the childcare responsibility should have led to an increase in FLPR, but that hasn't happened in India. Now, few of these studies actually tried to explore the linkages between the decline in fertility rate and the reduction in childcare responsibilities. And they found that although the decline in fertility rate actually led to lesser children per women, a growing consciousness about quality childcare actually increased the childcare responsibilities, particularly among middle income and higher income households. So, And also in Indian context, there is a switch, there is a shift from joint family structure to nuclear family structure. Now, under the joint family structure, the childcare responsibilities used to get distributed among many women in the household, which is not happening under the nuclear family structure. So these two affect the growing consciousness about good quality childcare and the shift to the joint family structure, to the nuclear family structure from joint family structure, are actually leading to the increased childcare responsibilities and outweighing the impact of the decline in the fertility rate. Now, childcare responsibilities, apart from negatively influencing females' labor force participation, it also negatively impacts women's choice of work. For example, sometimes women, while taking up a job opportunity, give priority to the flexibility in job over the remuneration in job, so that they can actually continue their childcare commitments along with the job. But however, there is very limited evidence on this front. Can we go to the next slide? So, to see how the care responsibilities are actually influencing women's labor force participation, I have estimated the share of women engaged in full-time domestic duties. This and treated this as a negative indicator, since the immediate impact of childcare responsibilities get manifested through women's engagement in full-time domestic duties. That's why I have chosen this indicator. Now, from the table, we can see that across working age men and women, the share of women engaged in full-time domestic duties is very high in both the rural and urban areas. In rural areas, it's 43%, and in urban areas, it's 55%. Whereas the similar share for men stands at less than 0.5% in both rural and urban areas. Now, to look into how the childcare responsibilities are actually influencing women's engagement in domestic duties, I have divided the women into two cohorts. The first cohort consists of those women who belong to household with childcare responsibilities, and the second cohort consists of women who belong to household without childcare responsibilities. Now you can see that the share of women engaged in domestic duties is much higher in both the rural and urban areas among women with childcare responsibilities as compared to women without childcare responsibilities. I also looked into whether elderly care responsibilities are also mattering in women's labor force participation decisions or not. But from the table, we can see that it's not mattering much, since the shares are not differing much between the two cohorts. Can we go to the next one? So apart from childcare responsibilities, however, there are a number of factors which actually influences women's labor force participation decision, or reversely, their engagement in full-time domestic duties. These are age, expenditure quintiles, education level, family structure, etc. Now, from the table, we can see that irrespective of the age cohort, expenditure quintile, education level, and family structure, the share of women engaged in full-time domestic duties is much higher among the cohort of women with childcare responsibilities as compared to those women without childcare responsibilities. However, as we look across the age cohort, we can see that the share of women engaged in domestic duties is much higher among the younger age cohort, which is basically these females being in their prime childbearing age. Secondly, if we look across the expenditure quintile, we will see that the share of women engaged in full-time domestic duties is actually increasing. Is actually increasing in the higher expenditure quintiles. Now, this is due to the income effect. What does it say? It says that as the household income increases, women actually withdraw from their secondary role of income earning and get more engaged in their second primary role of caregiving. And that's why their engagement in domestic duties is actually increasing. Also, as we look across the education level, we will see that the share of women engaged in domestic duties is actually higher among those in the high education level as compared to women in the low education level. Now, this also is because of the income effect playing a role here, because highly educated women are often associated with high expenditure household, high income class households also. Thirdly, if we look at the family structure, when it comes to the family structure, there are actually, under the joint family structure, there are actually two factors at play. Firstly, since the restrictive social norms are upheld in joint family structure in a more stricter form as compared to the nuclear family structure, it actually encourages women to stay engaged in domestic duties, and it keeps them away from the labor force. The second factor which is at play is that the child care responsibilities, however, gets distributed among many women under the joint family structure, and in that way, it actually leads to increase in female labor force participation and a decline in their engagement in full-time domestic duties. However, we can see for those women with childcare responsibilities that their engagement in full-time domestic duties is actually less in case of joint family structure as compared to the nuclear family structure. So the second effect is actually dominating over the first effect here. Can we go to the next one? Thank you. From the last two, three PLFS rounds, there is a new addition, there is a new additional module, and where a question basically gathers information about what women thinks are actually, what are the factors that women think are keeping them away from the labor force. Now, I have estimated the share of women who have cited childcare commitments as a factor, uh, as a reason behind them being out of the labor force. And we can see that the percentage is quite high in both the rural and urban areas. It stands at 67% in rural areas and 66% in urban areas. Across the age cohort, you can see a significant percentage of women cited childcare commitments to be the reason for them behind the out of the labor force. However, this share is actually extremely high for those women aged between 26 to 35 years, and that is also majorly because of them belonging to the prime childbearing age. Across the expenditure quintile and also across the education level, you can see that the very high percentage of women actually cited childcare commitments to be the reason behind them not being in the labor force. Can we go to the next one? Thank you. Now, as I mentioned before, that childcare responsibilities not only negatively impacts females' labor force participation, but also it negatively impacts their choice of work. As I mentioned, that they often give priority to the flexibility when while taking up a job opportunity. They often give priority to the flexibility in the job and not the remuneration, and thus actually a lot of women are actually engaged as unpaid family worker in family businesses, and these sort of non-remunerative engagements are not thought to be very high quality engagement. So I have estimated the share of women among the female workers. I have estimated the share of female who are engaged as unpaid family workers and treated that as a negative indicator, and saw across how the share differs. I saw across men and women, and among women with childcare responsibilities and without childcare responsibilities. So I saw that the share of women engaged as unpaid family worker is actually very high among the working age women as compared to working age men in both the rural and urban areas, and it's extremely high in rural areas. Now, between women with childcare responsibilities and without childcare responsibilities, a higher share of women are actually engaged as unpaid family workers. Um, a higher share of women are actually engaged as unpaid family workers among the cohort of women with childcare responsibilities as compared to the cohort of women without childcare responsibilities. Can we move to the next one? Also, we looked at how the interaction between childcare responsibility and other factors, which also influences their choice of work, are influencing. So we can see that across the age cohort, among women with childcare responsibilities, the share of women engaged as unpaid family worker is much higher as compared to those without any childcare responsibility. Um, and also, you can see that across the expenditure quintile and across education level, the share of women engaged as unpaid family worker is actually much higher in the cohort with childcare responsibilities as compared to the cohort without childcare responsibilities. You can see, if you look at the trend across the expenditure quintile, you can see that the gap between the two cohort is actually declining as we are moving up in the expenditure quintile. This basically implies that among women in the high expenditure quintile, once they are deciding to take part in the labor force, childcare commitments are not confining them much to non-remunerative engagements. This fact is being revealed from the declining gap between the two cohorts as we move up the expenditure quintile. Can we go to the next one? So, since I mentioned that there are many factors which actually influences women's labor force participation and also their choice of work, I have tried to control for those variables and isolate the effect of childcare responsibilities, and found that women who are belonging to household with childcare responsibilities are actually two times more likely to stay engaged in full-time domestic duties and thus out of the labor force. Similarly, with childcare responsibilities, they are actually more likely to stay engaged in non-remunerative engagement as unpaid family workers as compared to the cohort without childcare responsibility. As I mentioned, that from the descriptive statistics, we can find a strong presence of income effect. Childcare responsibilities are constraining less, are less constraint in case of joint family structure for female labor force participation, and also childcare is becoming a less influential factor for women belonging to upper expenditure quintile once they decide to take part in the labor force. Yeah, that's all from my side. Thank you very much.
Okay. Prakriti, just a minute. I think we are facing some, I mean, we are unable to hear you properly. I don't know if it's muted. Mute. I don't know if it's because there's a problem with your audio input or our output. Vidisha, are you able to hear Prakriti properly?
I'm able to hear you. I'm not.
Vidisha, unmute.
Yeah, I'm able to hear you. Shruti, I have unmuted and I'm able to hear you. I can hear you now. Yeah, I can
Are
hear
you able to hear Prakriti properly?
Yeah, okay.
I'm able to hear Prakriti.
Okay, then that's a problem at our end. Okay, Prakriti, you can carry on. Sorry.
Okay, all right. I was saying, okay. Thank you, Vidisha, for providing wonderful quantified evidence to denote how childcare responsibilities have been a key hindrance across the years, for especially for Indian women to join the labor force, and also showing the difference across how it differs across various factors such as age groups, education, and income levels. Establishing this, and with the women's labor force participation lagging across the world, Divya, could you elaborate on how care work is recognized across the globe? Are there countries that have introduced childcare programs as a part of their social security measures?
Thank you. Sorry, I'll just switch on the camera. Thank you, Prakriti. Yes, the answer to your question is yes, there are several countries which have introduced and successfully scaled up childcare models in their but why should we sort of, I mean, I want to begin with why should we, as IWAGE as an institute, engage with the question of childcare facilities? As Bidisha has already laid out, unpaid, inequitable and unpaid domestic care work is one of the biggest factors constraining women's labor force participation, right? Now, the solution to this is, the women from the poor backgrounds, who are compelled to work and also can't hire domestic private help, are left with no solution but to either leave their children on their own or take them to the work site. Now, a policy solution that has emerged for some time is center-based childcare facilities or creches. Now, while there are several theoretical arguments that equity-focused and gender-responsive childcare facilities improve children's health and women's economic outcomes, the empirical evidence on this aspect is a little sparse. And the lack of evidence is especially lacking in countries which are lower and middle income countries, where women's income earning capacities and their ability to participate in the labor force are attributed to other economic factors such as the lack of skills, etc. IWAGE in that context, since it builds and generates more evidence, has undertaken a couple of studies that sort of try to build on the empirical evidence, which show a direct positive correlation between the presence of childcare facility, center-based childcare facility, and women's labor force participation. In this context, IWAGE undertook a global review of the childcare models in 2019. The childcare model, it has two parts. It's actually three-part series, but the first two parts focus on the global childcare models. It's a comparative, it's a unique comparative exercise in which first there is a thorough literature on a global review of literature, uh, uh, emphasizing the positive correlation between maternal employment and center-based childcare facilities. So that establishes uh, the importance of childcare facilities for maternal employment. Then the review goes on to shortlist the countries where the government has introduced center-based childcare facilities and childcare models as social protection measures. The countries under consideration are Nordic countries and Latin American countries such as Chile, Colombia, Mexico. They then go on to study the various systemic factors which influence and help in scaling up and making effective these childcare models. The last part of the comparative review is comparing Nordic countries and the Latin American countries across all these parameters. The literature review as well as the comparison of childcare models points towards a positive correlation between maternal employment and childcare facilities. I'll want to end at that.
Okay. Thank you, Divya, for highlighting how care work is also unequal burden heavily borne by women across the globe, especially on the lower economic rung, and also highlighting the global landscape. It's also care is omnipresent in our lives, yet it requires acceleration for its recognition. And IWAGE, through its recent efforts, has also strived to understand center-based childcare services in India, for which I would like to invite Shruti to elaborate on the findings from IWAGE's study on unmet childcare needs among women in India.
Hi, thanks, Prakriti. So, Vidisha and Divya have laid out the context very well. There is a clear lack of evidence, both in terms of the status of center-based childcare and just childcare provisioning in India, as well as the link between childcare and women's economic empowerment. So, one of the studies that we did in collaboration was with SEWA, was on the estimation of unmet childcare needs of women in remote tribal districts and select states. So we all have learned through both literature as well as through literature as well as the data that Vidisha spoke of earlier, that quality childcare is an indispensable factor for women's economic and social well-being. There is a dearth of continuous programmatic support in terms of delivering some of these services, so as to reduce the childcare responsibilities of women, which is true especially in the case of women engaged in informal work. And the evidence is even more sparse when it comes to women from very marginalized groups, vulnerable groups belonging to, for example, tribal communities who are also located in hilly terrains, inaccessible geographies, where even the reach of certain ICDS programs sometimes is quite sparse, and even if it is functional, there are issues with operations. So in order to shed light onto this particular aspect, we collaborated with SEWA on this study, and we conducted primary surveys in 4 Indian states across 5 districts. There were 2 districts in Gujarat, Sabarkantha and Tapi. In Kerala, we went to Trivandrum. In Odisha, Kandhamal, and in Meghalaya, we did the study in East Khasi Hills. Just give me a minute, it's taking a while to change. The slide is...
Wait.
Has the slide changed?
No. Stop sharing.
No, now it has changed. Okay. So this was a quantitative study using a non-experimental approach, and we used purposive sampling. Now, before we get into what we go on to understand what we found, just an overview of the women we surveyed. As I mentioned earlier, that these were remote tribal districts, so 85% of the women surveyed belong to the scheduled tribe community, and these were women from within the age cohort 18 to 45 years who had at least one child in the age 0 to 6. And the average age of our respondents was 29 years. A little over 80% of the women surveyed were educated. Now 50% of them belong to households with a with the household size 5 to 8 members, whereas 40% were around 1 to 4 members. So we had like a good mix of women belonging to smaller nuclear setup as well as women in joint family setup. And I've also mentioned the monthly income of the range of monthly income of the women surveyed. There were around 40% who were earning less than 2,000, 23% belonging to the 5,000 to 9,000 bracket, and 17 belonging to the 10 to 19,000 bracket. So largely women who were earning much lesser than 20,000, largely ranging from 2,000 to 9,000 formed the major proportion of our survey sample. 45% of the women, that is nearly half of the women that we surveyed, were employed and were engaged in some form of paid employment, and 66% of them were small and marginal farmers. So this, one second, I need to shift this tab so that I can see what I'm doing. So women's time use, this is the average time spent in hours on different tasks. So the blue indicates mothers who are engaged in work for pay or profit, and the green indicates mothers who are not currently employed or working. Here you can see that the time use across both cohorts of women is quite comparable. That is, the mothers do end up spending similar amounts, a similar number of hours doing different tasks during the day, which kind of adds to the literature of double burden, which we spoke about earlier. That is, women who end up stepping out for work also end up spending as much time on different tasks, different unpaid domestic tasks within the household. Again. Yeah. Now, time spent on activities by mothers. So these are the different activities that time spent on different childcare activities by mothers. Again, you will find a similar trend. There's just a small difference. This is in minutes per day, by the way. There's some small difference in the amount of around 20 minutes. It's barely anything in the distribution of time where women are not able to spend as much time. Women who are working are not able to spend as much time playing in play activities with their children as much as those who are not employed. But the rest of the things, as you can see, are very similar. Now, working mothers' unmet need for we also asked the women who are working whether their workplace provides a creche or any childcare facility. So, as you can see, an overwhelming 74% of women said there is no semblance of childcare within their workspaces. And the table below just shows the distribution across the different states and districts. As you can see, largely the answer was no. Now, coming to the link between having to give up on a day's work because of childcare responsibilities. This is a simple question that we asked. Around 41% of women said that they had to skip work because they were engaged in some form of childcare. Now, if you see the number of days that they had to skip, around 27% women had to skip 4 to 6 days of work, and you can see that largely women have had to skip a good number of days during the month due to childcare responsibilities. And we must remember that many of these women come from very distressed economic backgrounds. They are daily wage earners. So missing even a day's work actually does have severe economic implications on the family as well as the woman. Now, preference for childcare. We also wanted to know that do these women and just generally families have any hesitation in the uptake of these facilities? But we found that if there is a facility that is provided free of cost within the proximity of their homes, and when there is an idea of safety in these facilities, women overwhelmingly said yes, that they would be willing to send their children to the childcare facility. As you can see, these are some of the bullet points just lay out some of the details within the states. That in Sabarkantha, Tapi and Kandama, more than 90% said that if a childcare facility was provided free of cost and near their home, they would send their child to the facility. So the percentages vary slightly in Trivandrum and East Khasi Hills, and 88% of the mothers in Trivandrum and 56 in East Khasi Hills indicated that they would not send their child to a paid care facility. Again, goes back to the point of we saw the income levels of these women, which also sort of kind of means that a paid facility is not something that these women can afford. Now, this is a question that we asked: how many hours would you send your child to Anganwadi centers? And as you can see, around 62.5% of the women said 4 to 6 hours. Now, I'll just go to the next slide and tell you that the other question, the follow-up question that we asked is for how many hours was the Anganwadi open? And again, you can see that most of them said 4 to 6 hours. So this is an important point to note that parents are typically only used to sending their children to Anganwadis for 4 to 6 hours. So an Anganwadi center that operates for longer hours is not something that is currently within their imagination, which is why this is an intuitive thing. This is something that is worth exploring further. So when you ask most parents their preference for how many hours they would like to send them, when you ask mothers how many hours they'd like to send their children to childcare to an Anganwadi, they answer 4 to 6. But we are assuming that that's perhaps because this is the current operational hours. Now, from our study, it was very, very clear that there is a need for proper childcare facility, regardless of its vicinity to the place of women's work or their homes. All states that we went to reported low availability of creches, and around 67%, that is like a very high percentage of women, have had to resort to informal or personal sources for childcare. In many such cases, these might not be the safest modes of childcare. Women have to leave their children in precarious conditions. And as I mentioned earlier, around 41% of the women involved in paid work had to skip work due to childcare responsibilities. Amongst the mothers who do utilize these Anganwadi services currently, tutoring of children was found to be one of the most preferred service, which was reported by around 75% of the mothers, followed by the provision of playing facilities. Now, going back a little bit on the question of the number of hours of operation, amongst the women that we surveyed, around 65% of the women wanted to drop their children off to Anganwadi centers before 10 a.m. And 56% preferred picking them up in the 4 to 5 p.m. window. Now, why this becomes important is that depending on the nature of the informal work that some of these women are occupied in, the timings, what time they would like to leave the children at the childcare facility depends entirely on the nature of work, when their work starts, and how long they have to spend at their workplaces. So this again sort of strengthens the point that this again strengthens the point that there is a need for augmenting of Anganwadi services. While the current Anganwadi infrastructure itself provides a very strong system for childcare, there is a reason for its augmentation, especially in terms of extending the work hours and probably also looking at having more workers, because an extended hours would then mean that you would need extra hands. But I hope I've been able to communicate this point that not all informal workers have set schedules, and because of that, there is a need for longer working hours of the Anganwadis, and that's something that has really come out through this particular study. I think I'll end with that.
Thank you, Shruti. You've raised some very pertinent points, especially how availability and quality of childcare services can actually be a significant solution to improve women's current burden, but the concerns of the available childcare centers and also for the kind of people and their work that they're catering to further adds to growing apprehension of using the available childcare services which are present in the country. So therefore, it's also important to understand the state of resources for the functioning and also maybe the universalization of these childcare services. So I would request Divya to come in and tell us more about this.
Hi, thank you, Prakriti. I'll begin with a disclaimer. This study is not yet out in the public domain. so I will be able to share only limited findings of the same. We will begin with the most obvious question: why do we need creches? It's going to reiterate a lot of points that have already been made, but let me go through it quickly one more time. Low participation is a huge concern for policymakers right now. Low participation of women in the labor force, basically. And there's a noticeable gap between men and women in the participation of the labor force. The most often cited reason has been the inequitable distribution of unpaid care work within the households. The situation is particularly critical for women belonging to the poor socioeconomic groups, especially the ones staying in urban areas. Because compelled by the economic necessity to work, they also do not have the resources to hire private domestic help to provide them with the childcare support. This results in time poverty for women, double burden, and also care deficit for their children. The children do not get the requisite care that they require for their physical and cognitive development, which is very important in these formative stages. Now, ECD centers or creches have emerged as important policy tools that working and employed mothers can take up, who have little or no resource to hire private help. Now, can we move to the next slide, please? Thanks. I'll begin this I'll lay out the study, but before that, I will talk about the current fresh childcare landscape in India. There are three service providers of center-based childcare facilities in India. One is the government, the other are CSOs, and the private sector. Now, the government is the largest provider of childcare facilities in India through the ICDS program. The Anganwadi centers under the ICDS program provide significant nutritional, educational, and health support to the children and lactating and pregnant women, mothers. But while they are there is a huge infrastructure in place right now, their working hours, their operational hours are limited, and they can't double up as full daycare centers for working parents. So that's a limitation in case of the Anganwadi centers, something that my colleague Shruti has just pointed out. We then have the National Creche Scheme. The National Creche Scheme is now named as now called Palana, but we must look into the history of what happened to the National Creche Scheme, because it was also an important scheme introduced to address the childcare needs of the socioeconomically poor women. The National Creche Scheme, since 2015, there has been a huge decline in the number and the quality of creches under the NCS due to administrative and regulatory difficulties and also financial problems. Now, the financial problems are largely the underutilization and underfunding of the scheme. The utilization of funding fell from 87 to 25% between 2013 to 2018. And subsequently, the funding of the scheme was cut, especially during the pandemic. The NWCD reported that the funding has come down from 53 crores to 4 crores, which led to the closure of a lot of creches from around 18,000 to somewhere around 2,085. Now, the financing gaps that are being faced by the National Creche Scheme, the creches under the NCS, are usually filled up by the workers or the parents. The Palana scheme has been introduced by the government. It's still being rolled out. And as of now, very few AWCCs have been established, Anganwadi cum creches. The scheme aims to establish around 170 standalone creches and 17,000 AWCCs, but it's still in its nascent stage. So are various sub-national initiatives that are being initiated by state governments. The other service provider, the CSO, such as mobile creches and Seva, They have been providing very great childcare facilities to the urban poor in India, and filling the gap and the unmet and addressing the unmet needs of the urban poor in India, childcare needs of the urban poor in India, and these models basically show us a way and can be scaled up through either government intervention or through the support of private sector players. Well, the thrust of the issue is that the private sector is still engaged. I mean, has just begun to engage with the issue of childcare, and state, I mean, the government has a central role to play in scaling up and financially sustaining the creche system in India. While there might be financing and capacity gaps that can be filled by the private sector, so the government has to be the main player in the process. So yeah, there are three things that we take away from here. One is that there are very few creches operating in the country. The creches that are operating are not of the quality that they should be. And third, if the creches are of good quality, they are so few in numbers that they're actually unable to address the needs of the large population of the rural and urban poor in India. Now, the importance of the study that we have undertaken is flows from the three observations. One is that creches are so important and they need to be universalized. They need to be made affordable, accessible, and inclusive. Secondly, not any creche will do. So the creches need to meet certain minimal quality criteria, for which, again, they should be well resourced. Now, so there are two questions. I mean, what is the resource envelope required for universalizing the creches? But that begs the question about what exactly is the resource requirement for running a good, well-functioning creche. This exercise has been undertaken with an awareness that this figure will differ across geographies, demographic groups that they cater to, the needs that they address, the rural-urban divide, etc. So through the study, what we have attempted to do is to document the existing fund provisions across different models and settings. And these estimates, I mean, we've also, I'll come back to that point in my research objectives. This might give the policymakers an idea of what kind of resources are required across geographies to scale up and financially sustain the creches in India, in various locations in India. Thank you. Yeah, so I will quickly go through the research objectives. Now, as I said, not any creche will do, so it needs to meet some minimum criteria. Now, this was, we started identifying the non-negotiable features and desired traits of high-quality childcare center. Now, this was done largely based on secondary literature review. The documents that were referred to are NCS guidelines, the National Creche Scheme guidelines, the PALNA guidelines, the various government orders, ASEAN guidelines for effective ECD creches. On this basis, we created a checklist which had almost 69 parameters, and that was used to ascertain the quality of creches that we eventually surveyed. Second was that we tried to examine the various ECD business models operating under different contexts in select states of Delhi, Karnataka, Haryana, and Kerala. Now, these models have varying financing and governance structures. So we wanted to understand their organizational structure, their functioning, the needs that they cater to, the economic groups that they respond to, the geographies they serve, the beneficiary perception, and the challenges they face. Particularly the challenges they face and the beneficiary perception, because that reflects on the quality of the services being provided by the creches. The next we move on, we assess the finances that were needed to maintain affordable and sustainable ECD facilities. We sought to assess these resources that went into running of these creches. And there were two ways we did it. One, we created a costing tool through which we assess the privately run or CSO run creches, which are privately funded. We laid down certain non-negotiable elements and tried to get cost estimates, and then eventually arrive at an estimate of a final figure of what it will require to run a creche, an annual sort of estimate for what it will require to run a creche. And this amount is again different for different contexts and varies with the service provider. The last part of the study was analyzing the union and state budgets for ECD interventions, which was undertaken through a secondary review of the union and state budgets. Yeah, can we move into the next slide? Yeah, so the methodology was a mixed method approach. We did purposive sampling to select the creches. We studied 38 creches under various settings, and budget analysis was done through secondary analysis of the budget documents. I've already spoken about this, I think. The limitations of the study, even before we begin to share the findings, I must share the limitations. So since the ECD models, as I said, vary according to the context, and they vary according to the governance structure, they vary across the rural-urban divide, there's no standardized model. And therefore, it's difficult to arrive at one particular figure that is required to run an ideal ECD center. Also, the policies being rolled out by the government are at various stages of maturity. For instance, the Haryana creche policy, the Palna scheme, all of these are in transition right now, and because of which we got varying responses from the people on the ground, from the policy documents, and from the program managers. This sort of created some sort of a confusion regarding how much and to what extent have these policies been implemented on the ground. Lastly, in terms of the infrastructure, we had a comprehensive checklist, but that checklist was limited in certain ways that couldn't capture the nuances of certain aspects of infrastructure. For example, child friendliness of design elements and types of structures, etc. And I think a more in-depth survey for that is required. Now, okay. Yeah, so I'll quickly take you through the budget analysis findings of the union budget. The share of ECD expenditure as a percentage of the total union budget has fallen from 0.93% in financial year 2020-21 to 0.55 in financial 2023-24. From 2020 to 2021 onwards, government expenditure in ECD schemes have hovered around 0.05%, which is rather low when compared to countries for strong ECD programs. So next slide. Okay, so yeah, among the states, we tried to identify the components where the states are spending the most in terms of their ECD expenditure. These are the states that we had surveyed. So Delhi is spending the most on nutrition, Haryana is spending the most on AW services, Karnataka is spending the most on nutrition again. It also has the highest proportion of ECD expenditure as a proportion of the total state budget, and highest proportion of ECD expenditure as a proportion of its GSDP. Kerala again spends the highest proportion of its ECD budget on Anganwadi services. Can we move on? Since it was a mixed methods approach, there were some very interesting qualitative findings that we thought we need to share here, and it will be important. Most parents felt that leaving their children with neighbors was unsafe, and they preferred creches. They saw both physical and cognitive development of the children while they were attending creches. Creches were especially beneficial for women, employed mothers from poor socioeconomic backgrounds. In Delhi, the choice, that was an interesting finding, that a lot of workers decided on their choice or on the location of the residence or work site based on the proximity of creches. In Karnataka and Haryana, government and EWC's workers played a significant role in promoting creches, while in construction sites in Delhi, most people learned about the creches through contractors, subcontractors, and relatives employed in the construction work or other informal labor. In Karnataka, Haryana, Delhi, parents expressed dissatisfaction with the limited opening hours of the EWC. Apart from the necessity of going to work, most parents were drawn to the centers because of poverty. These centers could provide facilities which the poor parents could otherwise not. So that also became an additional incentive for them to send their children to the creches. The supervisor in all states, especially in Haryana and Karnataka, were overburdened with work. Now, I think I've already explained the methodology of the financing component, but we drew on from Levin and McEwan's ingredients approach, where any intervention, the idea that is that the approach is that every intervention uses ingredients with a value or a cost. And once those ingredients are identified and their costs ascertained, we can estimate the total cost of the intervention. We identified the various ingredients that go into functioning of a high quality ECD center, but this include the personnel costs, facilities, referring to the physical space, equipment and materials, and various other inputs. So these elements or these ingredients were basically derived from our study of the National Creche Scheme document, which identified the essential components of a successful ECD center. Now, for the purpose of analysis, we divided the varied creches that we studied under 3 groups. Publicly funded creches. Within this category, we studied creches run by the Haryana government under the Haryana creche policy, and various models of creches being run by the government of Karnataka, Zilla Parishad, Taluka, and MG Narega creche, and Kerala, and the creches run by the Kerala government. Privately run and funded creches include the one run by mobile creches, their partner creches funded by corporates, corporate foundations, national and international development organizations. And these were usually located in the urban slums and construction sites in Karnataka and Delhi. The last one is the public-private model, which is the NCS model that we studied in Delhi. Yeah, so I'll first begin. I will quickly take you because I think I'm running out of time. Publicly funded creches in Haryana were the ones that we surveyed were the ones that were operating under the Haryana creche policy, which has an urban focus and is being funded by the DWCD Haryana government. Mobile creches is assisting the government in determining the optimal characteristics for the creche, its associated costs, and also providing training to the staff members of the newly opened creches. Now, the Haryana government seeks to open 500 such creches. The beneficiaries are parents from low and middle income families. Our costing exercises suggested that the implementation of Haryana creche policy will require an annual investment of 11,68,600 to 14,88,600 per creche across the rural and urban areas. The present annual expenditure per creche is around 3,59,000. Then come the publicly funded creches in Karnataka, which is the Zilla Parishad. Now, these are established under the MB Act, and basically, in many locations in Karnataka, district collector office and Zilla Panchayat office are co-located, and there's a need to provide employees with creche services. A total of 62 centers will be established in 31 district headquarters to cater to the children of visitors, regular employees, and outsourced staff. And based on the KIS, we have found that each creche runs on a budget of 4.65 lakhs. The Taluka Panchayats in Karnataka are again, it's basically to cater to the needs of the both formal and informal sector workers in areas where AWCs are not being able to meet the childcare needs of the people in the district or taluka. These centers will be run by the federations, SHGs, and NGOs. Based on the community's needs and creche space criteria, the center space will be identified either in an AWC or a government or building, a rented building near the AWC. The creche will or is running with an allocated budget of 5.67 lakhs. The third kind is the Manrega creches. Now this is around 4,000 creches are to be opened in 31 districts of Karnataka. The creche is basically meant for the Manrega workers, and that's why the timings are going to be flexible. And according to the timings of the parents working at the Manrega work site, the creche locations will be either AWCs or public buildings like community bhavans, school buildings, etc. And these will be running at a budget of 4 lakh, annual investment of 4 lakh per creche. So, yeah. As per the creches supported by Kerala government DWCD, most of the creches in Kerala are supported by DWCD. Some of the creches surveyed were partially also funded by organizational welfare committees and private funding. But the annual cost that we deduced, from the policy documents of the Kerala government, is 3,73,000 per creche. And these are based on the AWCC guidelines. So this is roughly the cost that the government has proposed for running of Anganwadi cum creches as well. We also visited privately run and funded creches in Delhi and Karnataka. These were mainly urban and were basically for parents living in urban slums and working as informal laborers. They were run by MC or their partners and funded by private players. The training of the creche workers and helpers was provided by mobile creches. Through the costing tool, we found that the annual cost of running these creches are around 11,37,520 per creche in Delhi, and an annual investment of 12,65,375 per creche in urban Karnataka is required. Now, insights. So these were the figures that we derived from our costing exercise and a review of our of the government schemes and documents. There are no benchmark figures that are available in public right now, which will help us assess the adequacy of these of these resources. But we could take on the figures that are provided by the government in their new guidelines about AWCCs, which says that 3,73,000 annual investment per creche is required. But I think a good policy to look in this regard is the Haryana creche policy. The Haryana creche policy meets most of the non-negotiable criteria of that we also concurred with, and the estimates run between 11 lakhs in the rural areas to 13 lakhs. So that is per creche annual investment. So that is something that gives us a kind of a figure that could be used for future advocacy purposes. The difference, of course, exists between rural and urban areas. In rural areas, the costs that we have calculated range from 4 lakhs to 5,67,000, while in urban areas from 3,59,000 to 12,65,000. Now, of course, human resources are more expensive in urban areas. So are the space and their space constraint. The urban areas, the space is very expensive. Rented buildings are higher, which bump up the cost of running the creche. So it's very important that the state becomes involved in ensuring the sustainability of creches. We would advocate a robust public-driven model supplemented by a combination of funding sources involving private players to strengthen the childcare infrastructure and services in India. the funding gap is very often closed by organizations such as mobile creches through their private funding. Public finance can help mobilize private finance, which again reiterates the role of the state. Since infrastructure requirements require setup costs and rent payments that bump up the budgets, state provisioning of creche space is crucial. And the provisioning of public infrastructure for running of creches is a significant advantage since they're in better shape, safer, and located in more accessible areas. As I said, Haryana creche policy could provide us with a benchmark figure and to evaluate various other government schemes and policies and interventions, and the budget allocations towards those. Another point that we can take from the study is that the budgetary allocations towards ECD interventions is not adequate to provide efficient services to the efficient childcare services in India. Yeah, I'll stop here. Thank you.
Thank you, Divya, for showcasing the extensive research that has been conducted, especially to understand the childcare landscape in the country, and also highlighting the resource availability or lack thereof, affecting the operations of creches and childcare support services that exist among us. Overall, I feel the discussion has not only helped to recognize the burden of care on women, but also aided in understanding the existing global childcare models, the quality of existing services, what could be their probable future, but by identifying available and potential resource needs within the various models that run in the country. So before I open the floor for questions, I think I'll just quickly wrap what has been said during the panel. So to summarize, we found that women's burden of childcare work deters them to participate in the labor market. And if they're working, it influences them to undertake flexible or low-paying jobs. These differences were highlighted when compared with women without childcare responsibilities and were found among all age groups, education, and income levels. However, it was also found that in the higher income groups, childcare responsibilities did not influence women's choice to work and the sectors they ended up working in. We also further delved into global models of childcare programs, setting successful foundations for future actions. And findings from IWWAGE studies helped us to understand the unmet needs of women, which depend on accessibility, affordability, and finally the utilization of available childcare services and centers in a few tribal districts in India. So that also helped us get a glimpse of the functioning and quality of certain childcare services facilities in the area, especially Anganwadi centers. And finally, the analysis that was just recently showcased of the available resources, existing gaps, and current and future resource allocation for childcare services and creches, and also insights both from the functionaries of the creches and also the people who are in need of them, also helped us shed light on the different kinds of programs and facilities that exist in the childcare ecosystem, and also what their probable future could be. What I feel was especially reiterated throughout the discussion is how working women undertake double burden of time spent on childcare and employment, with rising complexities of the supportive childcare centers. So thereby highlighting the choices women have to make to either not work or majorly choose low paying or non-remunerative work. Thank you all for the discussion. Now I will open the floor for questions. I have a few questions, but I think taking time into consideration, I'll also piggyback on one question asked by Janvi Shah. She's asked, I think Shruti or Divya, either of you can take this question, which is there scope to look at Anganwadi centers and improving Anganwadi infrastructure and services to help with the unmet childcare needs in India?
Thank you for the question, Janvi. I think there's tremendous scope for that, and I think Palna scheme is something that is experimenting with that. The AWCs are spread all across the country. They are not so many in the urban areas, which is a concern. I mean, for every 100 beneficiaries in rural areas, there are only 7 beneficiaries in urban areas of AWC. So to cater to the poorest of poor, both in rural and urban areas, AWCs, of course, can their hours can be extended, and human resources can be sort of more workers and creche workers and helpers can be taken on, and that would definitely help in providing childcare facilities more extensively than a standalone creche policy. But more and more AWCs need to be built then in urban areas as well. Their coverage is really poor in the urban areas. That's my response.
Thank you, Divya. I think that answers the question. The next question, again from Janvi, is for you, Vidisha. How are we defining employment in case of unpaid family workers?
Thanks, Prakriti. So, although the unpaid family worker, they are not receiving any remuneration against their activities, but you can see that they are engaged in the production of economic goods and services, which are also marketed. And that comes under the purview of work and employment, as the PLFS NSS follows. So that's why they are considered to be workers. And since they are engaged in the production of economic goods and services. Yeah.
Thank you, Vidisha. We have a few more questions. Rashmi is asking, Shruti, you can take this up. Is Seva-led creche model a best practice that is ready to be scaled up, and thus government may consider also to scale up in other rural areas?
Yes, so Rashmi, just to clarify that the study that we did in collaboration with Seva, we were looking at the Anganwadi services where Seva was helping augment the services. But there are, I also see the other question. I think I'll just answer both, and Divya can add on whether DNRLM can look at, cluster level federations and SHGs as partners of choice for CSR run fresh models. So I'm just going to combine the two. I think from the two studies that we have done, especially the financing study for creche, what we have learned is that there are different needs in different contexts. Even within rural contexts and across different states, there are different kinds of demands and there are different kinds of players that become important. So while the Seva creche model and it's already being run very well across many different states in India, and it can be looked at as a best practice that can be scaled up. There are also several other models, and then there's the mobile creches model. So these two models have been studied for over many years, and they are considered successful and something that has been suggested for scaling up. But there, I think the combination of models, combination of funding channels is something that needs to be explored. Regarding the SHG run creches, I think this is already happening. I mean, Rashmi, I'm sure everyone working with the NRLM already knows that across the country there are different models where cooperative run creches, SHG run creches exist. Whether it's Kumbhishri or some, I can't remember which states exactly. This is already happening, and I would think, yes, that cluster level federations and SHGs could be partners of choice for CSR run initiatives. Again, like I said, where there is such a demand and there is a strong ecosystem of SNGs.
Yeah.
Which again, like Divya said, since India is increasingly urbanizing, there is that divide in the urban. There is that gap in the urban space, especially even in terms of any sort of collective action by groups like SFGs, which happen very commonly in rural India. So we might have to explore some other options there.
Thanks, Shruti. Divya, would you like to add?
Shruti's already said what was required. But yeah, I want to add that Seva model of cooperative-led creches run across Ahmedabad, and they have been studied extensively. As I said in my presentation, both mobile creches and Seva models are things that we need because they define the non-negotiables very clearly, and also address the concepts of um, uh, address the needs of the urban poor very clearly. And they have been successfully doing so for several years. So these models are interesting, and they can be scaled up, but their reach is limited because they are CSOs, and so is their financial capability. They have been running with the help of private funders. Uh, Sometimes the entire program is run by private funders. Sometimes only the components of these programs are run by private funders. So there is a funding gap, and who will fill that funding gap is an important question. Bringing back, I mean, I will reiterate the role of state, that the state should take up these models and try to scale them up and ensure their financial sustainability. Yeah.
Thank you so much, Divya. Thank you, Shruti. Vidhi has a question. She's mentioned how we have mentioned about Anganwadi centers as a way to initiate addressing unmet childcare needs. So she also says that multiple studies point towards overburdened and underpaid healthcare workers, ASHA and Anganwadi workers, who have the dual burden of individual childcare and also care at work that they do. So she has two questions, which I think Shruti and Divya, both of you can take, which is that how do we make sure that the childcare needs are addressed without compromising the current workload of health workers who are particularly women? And the second question is, how do we make sure that gender roles and stereotypes on care shift so that men also contribute?
Yeah. I think you should take it.
So to the first question, I think first of all, recognizing ASHA and Anganwadi workers as workers, I think that would be the first step. And that's something that we've always advocated for, and not as community or voluntary workers. So recognizing their work as work and calling them care workers is, I mean, to begin with, there is that whole thing of language, the sort of language we use. Apart from that, from at least from the studies that we have done, especially the financing exercise and the augmentation of Anganwadi services, that is sort of pushing for the extension of hours. I mentioned very briefly that one of the additional things that would require is increasing the capacity, both in terms of training, but also in terms of the number of workers available at the center. From one of the centers that we visited, I think it was in one of the creches that we visited in Trivandrum or Kochi. It was in Kochi, I think. It was open for about 11 hours. The creche was open for about 11 hours, but there were 4 workers who used to work in shifts. So two of them in the morning and 2 of them in the evening. So when we say augmenting Anganwadi services of Anganwadi centers, or when we say or when we propose that Anganwadi cum creche model might be something that we need to take up. I think the Anganwadi cum creche guideline itself talks of additional workers, right? The policy guideline itself talks
of an additional worker and helper.
Yeah. So in terms of alleviating their work burden, what needs to be done is the provisioning of extra hands where needed. Like if there is a creche worker and a creche helper is needed, that sort of provisioning of work has to be done, which again goes back to the whole point of budgeting. One, they're also underpaid. 2, they're also overworked. That is, there aren't enough people doing the work, and the people doing the work are not getting paid. So it again comes back to the whole question of women's work and the feminization of care work. That is the second question that Vidhi has followed up and asked, how to also change and move away from these stereotypes. I think that comes from like a lot of awareness and like sort of things that we need to take up more in terms of all-round advocacy. But I think with women stepping out to work, that itself can change the dynamics at home, because there's a chart that I didn't show, but when we spoke that when I spoke of informal or social support for childcare, that is when women are not leaving their children at childcare centers, what are the other options they have? Many of them answered that their husbands are taking care of the child. But if the woman is not stepping out to work, there's never going to be that change, because I'll always be a woman's work within the household. Not that I'm not saying that is good, but one thing to change the gender stereotype is more advocacy, more awareness. But the other thing, very obviously, is that if women start engaging in paid forms of employment, men end up having to take up that work. That in itself is a step towards changing the gender dynamics. This is what
which I think brings us back to the original point that Shruti made, which was recognition of care workers as workers, and their pay not as an honorarium, but a pay. So, I mean, when we studied the Haryana creches, the Haryana new creche policy has proposed a significant increase in the remuneration of both the creche workers and helpers. Previously, they were being paid paltry sum of 3,000 the creche workers and 1,500 for the helpers per month for taking care of children, which is an extremely demanding job. But it has significantly increased through the new creche policy, and I hope the other states will follow suit.
Yeah, and I think just wanted to add that also something that people who are to this, the best thing to do is amplify the voice of care workers. Asha workers and Anganwadi workers have been out on the streets protesting for a while now, and they have been disgruntled by governments across states and across political party lines. So this is an issue, and they have mobilized strength and they have come out in large numbers, especially during COVID, like just after COVID. So I think amplifying their voices and making sure that these conversations, these questions come up in conversations like these is something that we can do to make sure the momentum around these topics are alive.
Thank you, Shruti. Thank you, Divya. Divya, there's one question for you from Himanshi Goyal. She's asking, what is the delivery model in Haryana's creche policy? Are they completely publicly funded, or it's a public-private partnership?
It's a completely publicly funded model. It's the Haryana creche policy has been initiated by the Haryana government, and it's going to be fully sponsored by them. They plan to establish 500 such creches, especially in urban areas. And mobile creches is playing a very active role in providing them technical assistance and training support, etc. Also help in monitoring and evaluation of the program that is being run. But it's not a PPP model. It's purely government funded.
Thank you, Divya. I just have another question. So also adding to what Vidhi said about not making sure that the burden of individual childcare and childcare at work for healthcare workers, based on your experience and the interviews and the FGDs that you conducted, what would be the ideal number of hours an Anganwadi is to function based on the responses that you got, considering that the working timings of different types of workers vary? For example, you did the Manrega model where they varied across according to their timing. So if it's as an average, what would be your answer?
The KIs that we did as part of the financing study, most parents wanted it for at least 8 hours, and some people wanted it up to 10 hours, which is not happening right now. But mobile creches, etc., are providing creches for up to 8 hours. Even the Haryana creche policy proposes 8 hours of work, operational hours of creches. So 8 hours is the minimum that a daycare center should function. Because yes, an interesting thing is the Karnataka model of Manrega creches, where the timings are flexible depending upon when the work of the parent begins. If the work begins at 6 o'clock, then the creche opens at 6 o'clock, and accordingly, it runs for 8 hours. But we can also say that not all workers work in the same timeline. So what eventually can be done is that, again, as Shruti has previously mentioned, that we should have more hands. We could do it in shifts. I think that is what they are also planning to do. Yeah, that will be
I
my
think
answer to
also
this. Yeah.
data, like you said, should be the minimum. But in the case of Kochi, that like, I was just thinking now that this question was posed, the creche which was functioning for 11 hours was functioning from 7:30 a.m. to 6:30 p.m. And we've already discussed that, different depending on the sort of work that women are involved in, they would need. Now, it makes sense for it to start at an earlier hour, because even our Seva study said that there is an overwhelming number of women who want to leave their children at the at the Anganwadi centers before 8 a.m. Now, if you think about it, these could be women, especially in urban areas, these could be women who are involved in domestic work. So if you need to go, because they take care of the care burden of other households where they're employed. So I think the number of hours of working should be from 8 to 12 hours. But more than that, the timings really matter, because an early start is important, and around 6 to 6:30 typically. This is not based on data. It is based on more on intuition and based on the different people we've spoken to, because we haven't tried to answer this question specifically, but from our experience and the people we've spoken to, and given that the Kochi run creche is an entirely publicly funded creche and it is operating for 11 hours, and they do have, I forget the number of children, but after speaking to the creche worker, what I remember is that both the morning shift and the evening shift, there are enough children. That means there are takers, right? So I think a needs assessment will help. A more hyperlocal needs assessment will help in ensuring that there are enough workers and there is, a corresponding resource allocation. But I think 8 hours is the minimum start.
Thank you. We have about 3 minutes to go, and I don't see any more questions. So I'll quickly use this opportunity to ask Vidisha a small question before we wrap. Vidisha, what do you think can be done to expand the current evidence that we have to improve the understanding of women's childcare responsibilities and also their
Thanks, Prakriti. So actually, from the current labor force surveys, we have the information that how childcare responsibilities are actually impacting females' labor force participation. However, it's equally important to understand how the childcare responsibilities are actually influencing their time use pattern as well. And particularly for women in the lower income household who actually can't afford to quit the workforce since they have to support the household income, and they conduct simultaneously the household work, the childcare commitments, and also the outside work without any hired help. So in their case, they suffer from time poverty, double burden, etc. Now, to generate evidence on that, how much double burden they suffer from, the time poverty they suffer from, we actually use more. We actually need more frequent time use surveys. So the latest time use survey happened in 2019. Another is on the way. So hopefully the result will be the raw data will be out soon, and we can use that data to generate evidence. So along with the micro studies, like IWAGE is conducting both the quantitative and the qualitative studies at national level, more frequent availability of the time use data would actually help us to update the evidence base in a more efficient manner. Yeah. Thank you.
Great. I don't see any more questions in the Q&A tab, and I think we're also wrapping in time. So I would like to thank everyone, the panelists and the audience, for joining in for the session. I hope everyone had a fruitful, thoughtful food for thought after this panel discussion. Thank you, everyone.
Thank you.